Floor is open. Anybody want to? You know what I'll do? I'll take just to get the process started, maybe since I'll take advantage of one of the statements that Andrew made on healthcare. Elizabeth, why don't you take a few minutes and talk about your perspective on the Affordable Care Act, and then let Andrew respond again, but if you could maybe go back and forth on that and elaborate on it for both of you, that would be great.
Sure, absolutely. As somebody who's worked on healthcare policy for about 20 years, it's something I've thought a great deal about. And certainly, I am a strong supporter of the Affordable Care Act. It doesn't do as much as it needs to do, particularly on the cost side. So let me just flag some of the things I think do still need to happen. But I do think we need to go forward. We need to continue to put incentives into our system from top to bottom to make sure we're paying for the things that lead to the objective we want. And that the objective is affordable healthcare, quality, affordable healthcare for all Americans. That really is the touchstone of what we ought to be spending our healthcare dollars on. Currently, this country ranks #1 in the world by spending more than anybody else. 17.5 cents of every dollar in this country is spent around health services. And our ranking for health is about 27th. So if you were running a company looking at the costs as #1 and the results as 27, you'd say we need to fix something. And that is why I do believe it was right to start down the road towards healthcare reform. There are a number of things we need to do. In Medicare, because prescription drugs have become such an important part of what our costs are for keeping seniors healthy. I don't know how many of you, I have a mother who's 79. My father had congestive heart failure. He was kept alive by medical devices and by prescriptions. But our Medicare system has not really focused on cost control there. We need to allow Medicare to negotiate for drug prices. It's become such a huge part. If you own a small business, if you're in the insurance industry, you know that insurance companies do that regularly. They use market power to negotiate drug prices. We have prohibited the federal government from doing that, and that just is foolish. If the market works for small business, for Aetna, then it certainly can work for the federal government to keep prescription drug prices lower. We need to provide incentives for team-centered approaches around healthcare. It is what something like the Mayo Clinic, the Cleveland Clinic have effectively done to match, again, treating the whole patient, promoting health, and matching the right level of care to manage that person's health. So there are things we can and need to be doing. I do not believe that overturning an Affordable Care Act, as Senator Roraback has proposed, makes any sense for a number of reasons. For one thing, predictability. You're in business, you know this. Billions of dollars have been invested by American companies, many of them here in this state, to comply with medical records, to begin to lay the foundation for this new act. So to overturn that unsettles all of that investment. To what end? The pieces that we get with the Affordable Care Act are many. Coverage of pre-existing conditions. Coverage for young people up to the age of 26. I have 2 in that category who have health care through our health insurance policies, through their parents. No lifetime limits on coverage. Closing the donut hole. Now, Senator Roraback has said he likes those parts. He'd like to keep those parts. Well, our children would also like to have dessert first and not have spinach, but it doesn't work that way. And again, if you're in the insurance industry, you know this. The only way to have coverage for pre-existing conditions is to ensure that people need to participate in the system. Otherwise, imagine this. Imagine the comparison. Imagine if you didn't have to have car insurance, and you could wait until after you got in an accident, and then you could buy insurance at whatever level you wanted, right? It would not work as a system. It does not work economically to do that. So again, I would challenge Senator Roraback and all those who are calling as a top priority to repeal the Affordable Care Act to say, how exactly is this going to work if you overturn it? And again, he has advocated for having the states do their own healthcare reform. Well, we did that in Connecticut. I was proud to vote for it. It's called Sustanet. Senator Roraback voted against it. So this notion that it will be done state by state, for one thing, that would mean maybe you get covered in Kentucky and maybe you don't covered in Connecticut. But it also means his own commitment to affordable care and to healthcare reform is not evidenced by his own record And so again, I think there are substantial differences, and you should know where we stand and how we're going to pay for these programs. Final point. It is simply not true. The $700 billion figure is simply not true. Calling the Affordable Care Act a cut of Medicare, it is not true. It's part of the Paul Ryan budget. These are savings from reducing overpayments to insurance companies. That's where that figure comes from. It has been debunked by every media outlet that has looked to say that claim. So don't buy that. We're not in a fact-free zone. We need to deal with facts as part of this election. I know it's tough for the 30-second sound bites, but it is important to know what the facts are. Thank you.
There's a lot of facts that should be at the center of this conversation. And I agree with Elizabeth that certainty is the thing that's lacking most in the minds of business people in Connecticut and around the country. The costs of the president's health care bill are a huge unknown right now. It is estimated by impartial observers that between 20 and 35 million Americans will lose the employer-sponsored health care they enjoy today because of the costs of the president's health care bill. We're talking about Fortune 500 companies like AT&T and Caterpillar, which are seriously considering dropping coverage because it will be less expensive for them to pay the fine than to provide coverage which is more than they feel they can responsibly afford. Understand what my position is. My position is we should obligate each and every one of the 50 states to come up with a solution that provides coverage to everyone. Massachusetts has a program, it covers 98% of their residents. Oregon has a program, it covers virtually all of their citizens. Neither of their programs is perfect, but if we direct each of the 50 states and if the federal government is a partner with each of the 50 states in solving this problem, I think we'll come up with a solution which costs less and which covers more people. Remember, 30 million Americans at the end of this process with nothing at all, no better off today, no better off then than they are today. Now, with respect to Sussnet, it's true. I did vote against Sussnet. Why? For the same reason that Governor Malloy, even Governor Malloy, isn't promoting Sussnet, because it wants to give everyone a Cadillac. And as much as I would like for everyone to have a Cadillac, in these times, we ought to be happy with a Chevy. And our eyes in the Connecticut legislature have been bigger than our stomachs. And that is why Connecticut's economy is in such a difficult position. So to me, there are three things. We can talk about the structure of solving the healthcare crisis, but let me promote three ideas that lie at the heart of the healthcare crisis. One, smoking. Two, exercise. And three, nutrition. If we can devote as much energy to promoting smoking cessation, healthy exercise habits, and good nutrition, that's how we'll begin to get a handle on healthcare costs, because premiums in Connecticut, the Connecticut Insurance Department is telling Connecticut citizens, brace yourselves for another huge health insurance premium increase next year. If the high-minded aspirations of this bill were to lower premiums and provide greater access, it's failing on both scores. I think we need to rethink how to address the problem.
Question in the back. Yes, thank you.
First off, I want to thank you, Oz, for moderating all these events that I've attended, and then for both of you for your effort at public service. And I will have to tell a bit of a story to make my point, but first off, what is the role of the federal government versus the state versus the local, and specifically in healthcare? The story being, when I was a young child, I had the measles. Dr. George came to the house, told my parents it was the measles, and then I heard them down in the kitchen, that was a $35 house call. My parents didn't have the $35. Dr. George stayed for dinner and got $25. Try to do that today. History is important to why we're a great country. We're not a European healthcare provider, we're not a monarchy, but why is it I can't negotiate? I ask my insurance company for an invoice. I do not pay by statement like most businesses. They can only furnish me a statement based on regulation. So there's a lot of regulation coming down on us. How do we eliminate regulation in healthcare so that at my level, and believe it or not, it's not the corporation. We are the people that make up corporations and companies. It falls on our shoulders. How do we eliminate government regulation to help us negotiate to drive down in a fair market economy or a capitalist economy the rates that we can afford? Does it really cost me $330 for an eye exam? Go to a different optometrist, it's a different cost. So how do we know? Thank you.
Great. So Andy, you want to take that one first, and we'll go to Elizabeth?
Sure. And his name was Dr. George?
Yes. He had a black bag and he came to the house.
And with the President's healthcare bill, there's something called the Independent Payment Advisory Board, a group of 15 unelected individuals who will sit in a windowless room in Washington and say to Dr. George, Dr. George, you will be paid $12 to go and make a house call. And Dr. George may well say, you know what, Independent Payment Advisory Board, it's not, the gas is going to cost me $14 to go to the house. You know, one of the problems with this bill is not only is it going to reduce payment to providers, to hospitals, to Connecticut hospitals, and Connecticut physicians by $400 billion over the next 10 years, the charges, the rates that they charge are going to be determined by an unelected, unaccountable bureaucracy. Now, 30% of healthcare costs are embedded in procedures which are deemed superfluous or unnecessary. One of my little achievements, and I guess Mother Teresa said we do no great things, we only do small things with great heart. One of my little achievements as a legislator was to introduce and secure passage of a bill that allows a physician to say, I'm sorry, when there's a bad outcome to a procedure, without having him or her have that statement used against them in a lawsuit. Might seem like a small thing, but I've been on the Judiciary Committee for 18 years, and when we had people coming to testify before us, I asked people that were hurt in medical procedures, did the doctor say I'm sorry? And they said, you know what, Senator Roraback, they never even had the decency to say I'm sorry. And if they had said I'm sorry, I might have not, I brought the lawsuit, but I was so angry that there couldn't even be an acknowledgement that a bad outcome had occurred, that I chose to bring a lawsuit instead. So all of that's a long way of saying, the part of Sustanet that I supported enthusiastically, I was on the Public Health Committee, was a portion of the bill that would have given healthcare providers protection from lawsuits when they adhered to peer-developed protocols. So like an airline pilot, if you went down the list, you checked this, you checked that, you did everything that the medical community has come up, this is what you need to do when someone presents with this circumstance. The original Sustanet bill had a component that said if doctors and nurses and hospitals went down the checklist, they wouldn't need to be afraid of being sued if there was a bad outcome. Now, sadly, when the bill came before the state Senate, that provision was stripped from the bill. And I offered an amendment on the Senate floor to try to put it back into the bill because I thought it was such an important piece of keeping healthcare costs down. Thanks.
Well, you're absolutely right, there's way too much paperwork. Let's look at the system that has developed organically in this country. It's just functional. We have 5,000 different healthcare plans. And every one of those healthcare plans has different forms. And so if you go to your doctor's office now, you all know this. It used to be, it's not Dr. George with this black bag. In my case, it was Dr. Coffin. Why he ever went in to be a doctor, I don't know. Why my parents would have chosen a pediatrician named Dr. Coffin, I don't. It was a Halloween joke. But Dr. Coffin would also, there were 4 of us, we were sick all the time, come with a little black bag. But right now, when I go to the doctor's office, there are 3 billion people behind the desk. Maybe there's 1 RN, or certified nurse practitioner, but there are 3 billion people, 3. And that is the kind of cost we cannot afford in this country. So I'll tell you what my idea was, and I tried to propose in the legislature and would push for it in Congress. Lock the insurance companies and the doctors, representatives, and the hospitals in a room and say, in 2 months, we want a single unified claim form, one, for the entire United States.